So thank you for joining in. This is our second live Q&A, and we've got about an hour this afternoon. I'm very pleased to welcome my distinguished colleagues. Today we have Professor David Rees, and we'll be joined by Professor Mark Layton. We also have Dr. Kofi Anie, MBE, and June Okochi. So, and Matthew is doing all the technical work, so thank you for that, Matthew. So that's who we are, and just in case you don't know who's speaking, I'm John James. So welcome. And what we wanted to do, we've had some questions in advance from individuals, and obviously we answered some of them at the last meeting, but I'm just going to read out a couple of questions and then we'll start. Not in order of priority, but we had a question that says, can my son go to school if my daughter has sickle cell and has had a splenectomy? So that's certainly a new question. So, and then there are some questions about blood donations and transfusions. So should we start with the splenectomy question then?
Shall I answer it? But, can everyone hear? Is it working? Yes.
I can hear you, David.
Okay.
Yes.
All right. I'll go. I mean, the splenectomy itself probably doesn't make too much difference to the answer to the question, in that, as we know from an early age, people with sickle cell disease have spleens that don't work very well. It may be that having had the spleen actually taken out makes a small amount of difference, but that wouldn't alter the advice. The general advice is that, see, if one child in the house is shielding because of sickle cell disease, then it hasn't been advised that the other child should also shield, although it's not. And that's based on the fact that technically shielding means you don't have any contact with other members of your family, which is obviously very impractical. So in practice, I think quite a lot of different things have been going on, and many parents have kept all the children at home for kind of logical reasons. And in other cases, the children have been sort of going out and contact's been limited in some way. So I think, again, it is a sort of grey area, and it's hard to give very extended patio and dining area. It's hard to give very clear advice about it. But I think it's a question of, you know, parents using their judgment and common sense. It's clearly important for children to go to school, and it's important, you know, for them to have normal social activities, and for the child without sickle cell disease to have as normal a life as possible. And I think ideally, you know, there is a compromise where the child at home with sickle cell currently, you know, can't go to school based on recommendations, but I think it would be unfortunate if other children, you know, in the same household couldn't, as long as the parents feel happy and confident with what's going on. Really, if there's a risk that if the other child is still trying to avoid exposure to COVID and other infections, the truth is, for children as a whole, in fact, children don't seem to get COVID as much as adults for reasons that aren't understood. And also, they very rarely get unwell, either with or without sickle. And so, although I'm not encouraging the idea that children with sickle should get COVID-19, the risks seem to be very small based on what we've seen so far. So I think it's a question of parents obviously using the judgment of what seems best to them, and taking kind of sensible decisions on what they know about their children and what risk they feel happy with. But from a medical point of view, I think the advice would be that the other child should go to school. But there's a lot of, you know, that involves a lot of discretion on the parts of the parents and respecting what feels right to them, definitely.
Thank you, David. We've also, can I also just make a request? If people are not talking, it might be helpful to just put themselves on mute, so that there's no background information which might be a little disruptive to those who are speaking and those who are listening. So thank you for that. Then we've had certainly June and I have had questions about transfusions submitted in advance. And there have been various different questions about it, but they can be summarised as, do we know enough about COVID to assure ourselves that it can't be transmitted in blood? So that's one. So there's a concern about, you know, do we know enough about this virus that it might be transmitted in blood? And secondly, also linked to this group of questions is it safe for me to continue to go and receive my transfusions? June, before we open it up, is there anything else you wanted to say about, because I know you two have had questions about transfusion?
Yeah, it's just really echoing that second question about safety of going into hospital for treatment. And I think we covered it at the first Q&A, because people are a bit anxious about going into hospital. So I shared my experiences, and I have continued to go into hospital for my exchange, but it might be to hear from the doctors, just maybe to provide some level of assurance about coming into hospital for treatment. Okay.
David, Mark hasn't joined us yet, so just one observation that I would want to make is just, and it's one that I've made before, one that is on our website, which is that these are worrying times, but we would encourage parents and individuals living with the condition to seek treatment from their clinicians when they need treatment, and that you know, may involve going into hospital. It may be virtual, depending on the hospital, but it's important in our view to do that rather than, to use my term, try to suffer in silence. So that's all that I wanted to say about it. But David, on the evidence about COVID-19 and transmission and transfusion, is there anything you would like to say?
Well, I think it's true that when people are very ill with COVID and they have high fevers, then you can find COVID DNA, RNA rather, in the blood. That has been demonstrated. But it's also true that I don't think there's been any documented cases of COVID being transmitted by blood transfusion. Blood transfusion services from the beginning were aware of the need to, you know, to avoid this possibility. And in addition to the normal screening tests that they have, you know, whether you can be a donor or not, then they certainly screen if you've had any. You're not allowed to give blood if you've had any recent symptoms or any possibility of having COVID. Obviously, the tests for that have changed as the testing and things has changed. So I think the risk is theoretical and very, very small. And as far as I know, and it would be kind of something that came out in the news and published very quickly, there'd be no documented cases of blood transfusion transmitting COVID. In fact, what you really want is a blood transfusion from someone who's already had COVID and has got antibodies, and that is being proposed as one of the tests. And people, blood transfusion service, one of the treatments rather, in the blood transfusion are currently trying to collect plasma from people who've already had COVID and have antibodies as a way of using this serum to treat people who are very ill. Obviously, when you have blood, it doesn't actually contain much serum anyway, so it's made nearly all red cells. In answer to the second question, I agree exactly with what's been said already, really, that I think hospitals you have all these things, you have to balance the risks against the benefits, and the risk of missing a blood transfusion if you're having it for a very important reason, which in people with sickle cell disease is probably quite significant, and the risk of getting COVID, having a blood transfusion is very small, and this risk has got much smaller. I think to start with, I work in a hospital and it felt like quite a dangerous place. It felt like there were lots of people walking around with COVID, but it's very different now. And I've been swabbed today, and you're swabbed. Everyone in the staff is swabbed every week to make sure they haven't got COVID, and patients are all tested for it. And patients with COVID are in a very confined area. So I think compared to maybe how it was at the beginning, now hospitals are probably one of the safest places you can be, in the sense that everyone has been tested, and pretty much everyone you meet will have been negative within the last week. So I definitely think, at this stage, then coming to hospital for blood transfusions or appointments or any other important reason, then I think it is a safe thing to do. Obviously, there's issues of how you get to hospital and public transport, but at the moment, obviously, the numbers are falling down, and the number of transmitted cases in London is getting smaller. So the risks are there, but they are much. I would say they're much smaller than the risk of not having the transfusion or not having other essential tests or treatment.
Thank you, David. That's very helpful and also very reassuring because of what's changed over the last few weeks. I just want to say to everybody who is on the webinar that Professor Layton has joined us, I believe. I'm just checking if that's the case.
Hi, everyone.
There's lots of people now.
Yes,
Professor Layton.
I did see him waiting, but we'll continue. So just this is the final pre-question that was submitted in advance, and then we'll open up because it's just about at 12 minutes past 4. So there continued to be questions about carriers because, or to use another phrase, people who have sickle cell trait or carriers, and the relationship with carriers and COVID-19. And we believe in the society that one of the reasons there's been so many inquiries about COVID-19 and any relationship with sickle cell trait is because the letter that went out included people who were carriers incorrectly. So all I wanted to say is, from a lay perspective, this is that whether you are a carrier or not a carrier, sickle cell, COVID-19 affects everybody. So if you contract it and you're a carrier, then it is extremely dangerous. But I'm not aware of any other sort of clinical link, and that's why we have our clinicians to talk about that. But I also wanted Kofi to say something about some of the anxiety and worry that contracting COVID-19, going to hospital, both for adults and children. So either Mark or David, do you want to say anything about carriers and COVID-19, and then Kofi about the sort of mental health impacts, which again were some of the questions for young people, children and adults?
Is Mark here? I mean, it doesn't seem to be, but I agree entirely with what you said, really, that people have worried. There's quite a lot of people who are sickle carriers were sent letters telling them to show up, which caused, a lot of alarm and distress. But there's no evidence at all that being a sickle cell carrier means that you're either more likely to get COVID, or that if you do get it, you'll be more severely affected. I think people are worried because of the higher, the higher risks to people of black ethnicity, and people are worried whether being a sickle carrier could be part of that. But nothing. And people have looked at lots of factors, and that factor hasn't come out in any of the studies. I mean, it's still fairly early days, isn't it? But there's no, as John said, there's no reason to think it would be true, and there's no evidence to suggest that it is true. In fact, all the studies that are done on being a sickle carrier, which have been done in Africa, show that it protects you against, not only against malaria, but a lot of other infections as well, that it overall has a positive effect on health. And there's been no study at all showing that carrying sickle makes you more likely to get any particular infection. So I think it's very unlikely.
Thank you. Kofi.
Yes, so I think anxiety and worry has definitely been of significant concern to more or less everybody. I think to start with, we didn't know much about COVID, so to speak. And then all the initial reporting about the news was to do with hospitals being possibly overwhelmed. And also in a practical sense, people would look at their local hospital and see that there would be significant number of people affected with COVID. So being sort of anxious and also being worried at home, just from media information, and also there were lots of misinformation on the social media platforms. You know, a lot of information circulating about possibility. I remember earlier on possibility of red blood cells being affected by COVID. You know, so if you take that all together, people will definitely be quite anxious about having COVID with their sickle cell, but also then going into hospital where even if they didn't have COVID, they would think that they could be infected just being in hospital. So the pathways through Anie and onto the wards in the hospitals had to change in response. But at the same time, that didn't assure people. And I'm sure for most of us looking after people with sickle cell, we would have seen that there was a lot of anxiety when people were symptomatic. And that is parents and individuals with sickle cell themselves. We had to do a lot of work convincing them to go for treatment in hospital, because obviously some of the symptoms that were associated with COVID are symptoms that we also know could present in terms of sickle cell as well. And sometimes delaying treatment would mean that they would also have problems in terms of complications with their sickle cell. So it's been a major issue and it's still ongoing. I think shielding has been very effective, but at the same time, from a psychological point of view, it may have frightened a lot of people into staying at home, which has helped. But at the same time, when things start opening up, it may be difficult in terms of dealing with the anxieties that people may have, just going out socially to start, and then going into school as well as going back to work. So I think we still have quite a lot of work to do in that sort of area, dealing with anxieties generally.
Thank you, Kofi. I think that concludes the main series of questions that we received in advance. So we can open it up now, and I'll look to Matthew to open up in terms of people who want to ask questions of the panel.
Yes, yeah, we've had a couple come through in the chat. Let me just find one here. One was around, has the specific risk to healthcare workers been identified in the risk assessment of BAME individuals as far as sickle cell disease and sickle cell trait?
Kofi and David, you're both health professionals, so so this is about risk assessment of BAME healthcare professionals.
I saw Mark appear briefly. Is he on there?
Is Mark on the call?
I am.
Yes, I think so.
Yep, he is.
Here he is. Great.
Yes. Hi everyone. Can you hear me?
Yes.
Yeah. So I think the question was about the risk to people working in a healthcare setting from Black and other ethnic minorities, and this is obviously something that's received a lot of attention both in the media and more recently through the report from Public Health England. And most healthcare settings are now undertaking a fairly comprehensive risk assessment for individuals, not just on the basis of their ethnic background, but also on the basis of other health conditions that we know might increase the risk of severe illness from COVID-19. And those assessments are being used now to try and provide maximum protection, sometimes in terms of different working practices or working in COVID protected areas for vulnerable individuals. As to what underlies that risk, I think that's still an open question, and one that will be answered by much of the research that's being done to look at the possibility of genetic factors that may contribute to risk of severe COVID in certain ethnic groups, but there aren't any clear answers yet to that question. David might wish to add to that.
Well, I agree entirely with that. I think it's, as you say, ethnicity is definitely one factor, but it's not the only factor or the most important factor. And being male is a big risk factor, and age is a big risk factor. And I feel I lose out on both of those, unfortunately. So I think you have to look at your individual risk score and individual assessment, which is exactly what Mark said is being done, and recognise that, well, two things really. People, black and ethnic minorities are at high risk, and there probably is more anxiety amongst that population because of some of the publicity. And I think traditionally people, certainly in hospital settings, in general, white old men can make their feelings known fairly quickly, whereas people working in kind of, where some of the black and ethnic minority people work in kind of less, I'm not sure what the right word is, but non-health, non-sort of doctor settings, it's harder for them to express themselves. And I think it has been harder for them to get, for the risks in those for people to get acknowledged. As people said, there's no shortage of old white men around, but we do need to protect sort of younger people definitely as well.
June, do you want to add anything? Because you're a healthcare professional yourself.
And a young woman, I would say.
No, I think all the points have been covered, really. I think from my perspective, there are, in my workplace, there are risk assessments being individually carried out for all BAME colleagues. So, and those risk assessments are based on personal circumstances, whether one is shielding, whether they've got family members who are shielding, whether they've got a health risk, social factors. So yeah, I think it's important that we start to personalize these risk assessments based on, the population that the COVID virus is affecting, because I think everyone's right to say that it's had a massive impact on BAME staff, so we need to take it seriously. But I would advise that if people have any concerns before returning to work sites, because I'm still working from home, it would be helpful to just ensure that a risk assessment has been carried out and you're in agreement with some of the recommendations that have been produced. So, yeah.
Thank you, June. Thank you.
John,
Matthew,
can I just
go ahead, Kofi.
Make a comment in terms of the involvement of the Sickle Cell Society in sort of some of the work that needs to be done, especially around risk, but also in terms of future recommendations that could be fed into the sort of the broader work that is being done for BAME sort of health professionals and social care professionals, so to speak.
Yes, it's fair to say, and I know there's some trustees on the call, but it's fair to say we discussed that at our last board meeting and are very clear about our desire as an organisation to influence certainly the work that Professor Fenton from Public Health England did and other work, the Equalities Ministers doing work, Lord Simon Woolley is doing work. So all of that needs to be sort of calibrated, but we want to be there influencing so that change, and by change I mean that there are some serious underlying healthy inequalities for people, and we want to see recommendations that deliver change in a strategic and practical way. So be assured on that point, Kofi. Matthew, I see we've got a clinician who wants to ask the question.
Yes, I believe we do. Let me just unmute them. Yes, Dr. Ivan Hugh has raised his hand to speak. Should be able to unmute and say something now.
Dr. Ivan, can you hear us? Okay, we'll have to come back to him if he can't hear us, because there are other people waiting in the lobby.
Okay, so we've had a few questions, particularly around shielding, about whether people should be shielding, whether they're going to be shielding until a vaccine is found, particularly around what they should do around sort of money and finance if they're not on PIP during this time of shielding.
Well, I'm happy to start. Again, this is from a lay perspective and based on the current advice on our website. The advice is to continue to shield. Now, how long it will last, one doesn't know. It's certainly not going to end before the 30th of March, and I suspect it will continue for some time yet. They've made some changes that leave it to the discretion of individuals to, go out, take exercise. But the key thing is, if you do that, you still have to socially distance, you still have to wash your hands. So I guess the advice is to be careful if you're shielding. And I'll come to the second question, but June, you've been shielding, so and of course they've lifted some of the shielding requirements, but do you want to add anything to that? And then I'll come back to the second part of the question about support in terms of money, food and
Yeah, so I have been shielding for about 10-11 weeks, and then I just started to get a bit just really frustrated being stuck at home, a bit of cabin fever, and I started to walk about 2 weeks ago, just take daily walks to break up my days and my weeks and just help my circulation as well, a bit of exercise. I'm still semi-shielding. I do not go into the supermarkets or even public parks, and I'm still working from home. And I think I'll be working from home for a very long time. So obviously we don't know. I mean, there's all the guidance from the government saying the R rate is low and therefore the risk is lower. But I'm just still using common sense as and applying my own social context to the decisions I make. But I think obviously if people feel like they want to go out and get some fresh air or have a walk or meet one person in the park, the government has advised that that could happen. However, I think it's important to just tread with caution and be very mindful of your environment and people you're hanging around with, and ensuring that social distancing. So yeah, that would be my sort of position on shielding.
Thank you, June. And on the second question, and I remember touching on this at the first live Q&A, the importance, in my view, of family and friends to support in these difficult times. But there may be people who don't have immediate family close by, or friends that can help out. So if there are serious problems about access to resources, so PIP and those things aside, then you really should be making contact with your local social services local authority to I mean, there are other providers who provide that sort of support, but if one is shielding, then I would strongly recommend contacting the local authority social services, who should be aware of people in their areas who are shielding because they're on the government list. Can we try Dr. Ivan again, just in case, and take some more questions from the lobby?
Yeah, so Dr. Ivan said he can hear, but his microphone was muted. I think I've unmuted it, so you can give it a try. I'll see if I can.
John, I just wanted to add a quick comment.
Go ahead.
To what you said about the support, because I think some people, unfortunately, were missed off the government list that went to the local authorities. So I think it's also worth just going to the website and registering. If not, in terms of access to email or online, you can also, there's a telephone number that you can phone. Because I know certainly some people did not get any information about support, and we kind of advised them to register as well as to try and use the phone line to be made, to make themselves aware of the sort of provision that will be available locally.
Thank you, Kofi. That's helpful, very helpful advice. If Matthew, we can't get Dr. Ivan, he could submit it by text and we can read it out. But let's keep going so we can take some more questions from the lobby. We have a little silence at the moment.
Looks like Matthew's dropped out.
I'm back in now, so I dropped out temporarily for some reason.
Right, okay.
Back in.
Okay, Matthew, just fire in the questions because I can't see them. So if you let people through, and we'll keep answering their questions as best we can. Okay,
so we had quite a lot of different questions, different situations around essentially, should children be going back to school if they have sickle cell? Some of GCSEs and important exams coming up, and they want to be getting all the education they can, but they're worried about what it means for them going back. Should they go back as soon as the school opens or wait until September? And how to be safe when they are back in school.
Who wants to take that one? Is that you, David, or?
I can say a bit. I think yes, the recommendation is still that children with sickle cell disease shield, which effectively means they shouldn't go back to school. And I think it's probably unlikely that that recommendation is going to change before September in time. I agree entirely with what people say. Going to school is very important, and people are, every day is critical in a way, and that people are missing out on education. And it has it's not that shielding is a unreservedly positive thing. There's a downside to it as well. I think, and there's, the other side is, as we said, the risk to children overall is small, and the risk to children with sickle cell disease seems to be very small. But and I think I think if parents felt strongly they wanted their children to go to school and felt it was safe, no one would criticise them for that. There would be no saying you can't do that. On balance, most of my experience of talking to your parents of children with sickle is that still the majority are still very nervous, and that even if people recommended going back to school, wouldn't be keen to send their children back to school. So I think, as you said, I think till the end of the 30th of June, it's clear the recommendation will be is shielding, and I can't see that changing, to be honest. But I think we are moving towards the idea that there's blanket shielding, and this is the same for everyone. I think, as June said earlier, it's gradually changing. It's a question of more recognising what the risks are and making sure that everyone knows what the risks are, and then people deciding for themselves what risks they're prepared to take. And in shielding, on the one side, the risk is you stay at home, you have psychological problems, you miss out on education, but you feel safe. And the other side is that you go out, you go to school, you get an education, but you might get COVID, and there's no right answer to where that balance lies, and it depends on individuals, having all the information and taking the right decision for themselves. And I think we are moving towards that sort of approach, rather than this is what you must do, everyone must do this, we must do that. But June said shielding means different things to different people, and everyone has done different things. And again, when I've spoken to parents, very, very few, if none, do shielding in the strict sense, which would, for a child would mean they stay in, they have no physical contact with other members of their family, which is clearly, who are going out, which is clearly impossible for most people. I don't know if there was a nice article in the newspaper about photographs of people around Hackney who and how COVID had affected them, and including a girl on a scooter who said, "Oh, I've got sickle cell disease, so I must shield," but she was kind of out scooting around and said, "I only go out for shopping or something," which is nice, but I think it's clear that it means different things to different people.
Thank you, David. Thank you. Matthew?
Yes, just further things on the shielding. What if it's not the child? The child doesn't have sickle cell, but the parent does. Does the child need to stay home in order to protect the parent?
I would say no. But again, it's a question of, that family deciding what the risks are of the parent getting, catching COVID from the child versus the child missing out on education. And I think it's difficult, and certainly there may be some parents who are very vulnerable. They've got other problems, like may make them more vulnerable, things like diabetes or heart disease or whatever, and it may be that risk feels unacceptable. But as a general rule, I think wherever possible, it's good for children to go to school and receive a full education, and maybe that would mean having some sort of separation between the child and the vulnerable parent at home. Again, I think it's a question for, every family is different and has different feelings about it. And I don't think you can say medically this is definitely what you must do.
Thank you, David. Any luck with Dr. Ivan or not? Because he's been waiting a long time, but he can probably hear us, but not.
I think he can hear us. It's saying that it's muted, although it's not muted at my end, so I'm not sure if there's a technical issue going on there or.
Okay, well let's move on to another question then from people in the lobby.
Okay, let's open that up. Someone has asked, have there been any known cases of a child with sickle cell contacting COVID-19 in the UK? And if so, what is the outcome?
Good question. Not one I've had before.
Would you like me to answer that?
Yeah, Mark's got the data on that.
Thanks, Mark.
The haemoglobinopathy centres in England have been collecting information on the number of people with sickle cell who have a suspected or confirmed case of COVID-19, and one of the remarkable things about that is how few children have been reported with COVID-19. I think the numbers are very small, really. Certainly only around 20 or 25 children have been reported during the course of the pandemic so far, and the outcome has been favourable in all of them. So it's one of the things that has influenced us towards thinking that COVID-19 probably doesn't represent a very high risk to children with sickle cell disease, except perhaps in certain very specific circumstances, for example, children who've recently undergone a bone marrow transplant. And we hope that this information will feed into the policy on shielding and enable a more nuanced or tailored approach in individual patients of different ages.
Thank you, Mark.
Dr. Ivan has said in the comments that he says it's not a question of susceptibility, but the consequences of deoxygenation in those with sickle cell disease, which is what he was trying to say. And then we've got, and there is a question. Would the society provide a basic risk assessment guidance for employers?
We didn't hear that question, Matthew, so you cut out.
Would the society provide a basic risk assessment for employees?
For employees of the Sickle Cell Society or employees generally?
I think it means if someone's going back to work and how they can take that sort of risk assessment that you've sort of been talking about. Is this something that we could help provide to their employers to help sort of guidance on that?
It could be something that we can look at because the relationship we have recently provided guidance to employers and employees in relation to sickle cell, but this was pre-COVID. So if the question is, can the Sickle Cell Society help with having some generic risk assessment guidelines for individuals who live with the condition, then it's something we can have a look at, because going back to June's example and also David and Mark, who are health professionals, it's clear that in the NHS there are risk assessments of staff being undertaken. So, but that may not be the case for all employees, but it is something that we could look at, and if we have the capacity, expertise and resources to do it, then we will try to do so.
Okay, excellent. And there's a question about, is there any specific support, sort of psychological or counselling for teenagers who are struggling at the moment?
Okay, I think that one's definitely for you, Mr. Anie.
You're muted, Kofi.
Okay, so, well, I think the issue about psychological support is kind of variable depending on which part of the country, but also which specialist services you may be affiliated with in terms of being your local hospital or, you know, sort of the area where you are. And I think it's still quite patchy, and so for some people it might be difficult to access specialist psychological services in terms of psychologists who are specifically working with people with sickle cell, but it may be the case that especially through your GPs, for example, you'll be referred to the local psychology service. Now, broadly speaking, they use the term talking therapies, and so that might be the easiest access for people who may not have the opportunity of being seen by a psychologist within a specialist team. But I think, generally speaking, in terms of COVID, the recognition is there that talking therapy services should be able to offer support for people, not necessarily only about their sickle cell, but also in terms of anxieties that might arise as a result of COVID as well. But I think it is definitely an important issue that needs to be addressed.
Thank you. Thanks. And I wonder whether this, dreadful condition and the fact that you're talking about counselling and anxiety is an opportunity to try to address some of those patches that exist in the country, because we broadly know where psychological services are good for people with sickle, and we know where it could be better.
Yeah, I think there's an opportunity, especially if we worked through the society to. I think it will be useful to actually do some kind of a needs assessment to start with, to identify exactly what has been available for people, especially in let's say areas where there's a low prevalence of sickle cell per se, under the COVID circumstances, and how people have managed to get or not receive any support. And then we can use that as a means of trying to address the issue and the concerns that people might have had to experience without necessarily having the opportunity of talking to psychologists within their area.
Okay, Kofi, thank you very much. Matthew, some more questions in the lobby, I think I can see.
Yeah, so we've got a couple relating to work. Someone who's a teacher wanting to know whether they can need to continue shielding until September, or can they take the risk with just penicillin? And also, if they other people returning to work, is that safe to do so with the appropriate PPE?
Who's going to deal with that one? I guess I'll start, but I'll look to my colleagues. But I think I answered earlier that people should continue to shield. Shielding is going to be here till end of June, and I believe beyond that, and that if you like, these new lifting of restrictions have given people a degree of discretion. So if an individual with sickle wanted to return to work, that would be his or her personal decision. But I guess the advice is clear. Don't. If you can work from home, work from home. That's the advice. I guess, my view, and going back to what we know, and David's confirmed this, is that people are more cautious about wanting to return to work. Social distancing will still need to apply. The employers will still need to ensure that the work environment is COVID compliant. So, if somebody asks me, frankly, I would say, don't return to work if you don't need to return to work. Keep shielding and work from home, or get some dispensation from your employees. But if you chose to go back, you would have to be really very careful, make sure that the environment was compliant and adhere to all the social distancing rules. But I guess I would say, stay shielded.
I think I agree with that. And the specific question about a teacher, I think, is more difficult, really. But I guess teacher, if you have sickle cell disease, you're recommended to shield anyway. So, and going back to teaching, doesn't sound like a good idea. It seems the risks are likely to be higher in that sort of environment. I think if you worked as a lighthouse keeper or something, it might be okay to go to work, but you have to decide for yourselves based on your risks, I think.
Thank you, David. Thank you. Matthew,
Oh,
more
sorry,
people
John,
waiting in the lobby.
we've missed Dr. Ivan's question.
Well, I guess I think it was more of a comment I think he was making rather than the question. But what I suggest, Matthew, is let's carry on because time is catching up with us, and let's take some more questions from the lobby.
Okay, we had a question. Also, Funmi has raised their hand, and so I think that means they've got a question. So I'll just unmute you if you would like to, yeah, ask your question.
Oh God, sorry. Yeah, can you hear me?
Yes.
Yeah, we can hear you.
Oh, thank you. My name is Fumi. I'm actually talking from Liverpool, from Liverpool Sickle Cell Support Group. And I just want to ask a question, basically. My son, who was supposed to start the GCSE, but because of the COVID-19, so that's been stopped. So we'll be starting the A-level coming up in September. One of the problems he has is he was badly affected with the children. So we in Liverpool, we're very lucky with the children's services. So we have the psychologist based in the hospital. So they looked after him. They're very, very amazing. One of the things he said was that there's no good support from the teachers in school. He's badly affected. He hasn't even got the energy to open his book because of all the psychological effect. And when I spoke to the school says to me, oh, because of child protection, we can't do any more. We can't do like Zooming. So all they've been doing is sending online work to him. But this is a child who hasn't got energy anymore, who's given up on everything because of the psychological effect of shielding. I just want to know, is there anything more I should be doing? Is there anything I'm missing here? Because the school is not helping. They said basically we can't do any visual teaching with him. And I'm worried coming September, it's gonna have missed quite a lot of things, and I don't know what to do. I just need somebody who can give me advice on what else can I do to help him. Thank you.
I think I'm looking at Kofi.
Yes, I'm looking at Kofi as well to start, because this is a good example for me of, you know, a young child with sickle cell, an important stage of his educational journey.
Yeah, I think one of the difficulties in terms of the closure of schools has been the fact that, especially those children who actually need more support, some of these children have been on education and healthcare plans, for example, and they haven't been able to access the one-to-one support that they would normally get in school. So I think generally speaking, it's been quite difficult, and I think given the numbers of teachers who were probably available to support the children, it didn't actually help for those who needed extra help. So from this perspective, I think trying to answer this question specifically, I think it may be the case that when it looks like schools have gone back, and maybe there might be more opportunity for getting some additional support from within the school, apart from just the teacher, just to see whether that might be feasible in terms of trying to help individual children. But I think it will boil down to a case-by-case basis, because at the end of the day, it depends on how much resources that the schools might have, and also the opportunity of working with children on a more like a one-to-one basis, even when they are still shielding. Because I suspect that, you know, obviously because sickle cell children are more or less going to be staying at home until September, there might be some gaps in that as well. So it might be worth looking at maybe the local education department as a start to see how they can maybe try and identify some support that they can provide through that kind of department directly, as opposed to falling on the individual school as well. But it might need some careful sort of manipulation or whatever, in terms of trying to look at what is available in the school and maybe looking at the education department as well.
Thank you, Kofi. And what I would say to Fumi is, if there's anything we can do through our helpline and information service outside of this webinar, we will do our best to facilitate that. Now, I can see we've got, I think Dr. Ivan came back and Yamadi Thomas came back, so time is getting upon us, so let's try and cram in a few quick questions.
So Yamade, would you like to say a question?
Yeah, no, I didn't go anywhere, did I? But I put my hand up though. I was just saying that I've just typed a comment to Matthew about this being a good forum to advertise the survey the society is doing about shielding and about COVID in general. If people are on this forum, because we have over 60 people tuned in, if you don't know about the survey that we're currently conducting around the effects of COVID, please go on our website. Matthew will put the link there and fill in the questionnaire, because that's another opportunity for you to, to say what you want if you can't say it here. So that's a comment really, that the society is currently doing one survey and we'll be doing another one in collaboration with a whole group of other charities. So please look out for that, because I don't think Matthew has everybody's contact.
No.
Thank you, Yamadi. That's a very helpful suggestion, because it goes back to something that Kofi said earlier about sort of, collecting the evidence on the impact of COVID. So thank you, Yamadi. Let's get some more questions in.
Dr. Ivan, let's try you again and see if this is working. Is that working?
It's very mysterious.
Okay, I think we're having some technical issues, so let me load a question. We had a question about getting an antibody test whilst attending an EBT.
What's the question, Matthew? I didn't understand it.
The question was, can we have an antibody test when attending EBT?
Shall I answer that initially? Yeah.
Go ahead, Mark.
So antibody tests are becoming more readily available, and a lot of hospitals will provide those on a routine basis now. In addition to that, patients who are attending for exchange blood transfusions would normally be tested with an antigen test, often at the time when they attend for the cross-match, to make sure that they don't in fact have COVID-19. But if there is a good reason to do an antibody test, perhaps they've had some respiratory symptoms in recent weeks, then that should be something that is available.
Thank you, Mark. Thank you. Can we take a couple more questions, because we've got about 3 minutes of the allocated time. So let's take a couple more questions and then I'll round up.
So does one build an immunity to the virus after contracting it?
I think everyone hopes so, but there's still not a lot of strong evidence to support that. I mean, on the grounds that in almost every infection you get some degree of immunity, then there's no reason why this should be different with coronavirus. I think there have been documented cases of people getting positive swabs in their nose and then becoming negative and then positive again, but that's not clear whether that's a second infection. I think the worry has been that some sort of coronavirus is like rhinoviruses that cause colds. You don't get very strong immunity and it's quite short lasting. So I think the truth is people still don't know. I don't know if Mark knows any different, but it ranges from you get the infection once and you have lifelong immunity, or you get the infection and you're slightly immune for a few days, and it's somewhere in the middle. But I think certainly you get some degree of immunity.
I think this was something that can also confuse individual patients, because if they have had COVID-19 and recovered from that, they may not understand really why the advice is still to continue to shield.
Yeah, but that's an important point. It is still very much the case that even if you've had it, you still need to take all the precautions, because we don't know about the immunity.
Thank you both very much. So 2 final questions, and then just an announcement I need to make at the end. So
okay.
2 final questions.
Someone has said, could the lower number of cases of children who've contracted COVID-19 be to the fact that the majority have been shielding? Could the numbers then increase once shielding has been lifted?
Well, I think, as we said, shielding is maybe part of the reason why there have been so few problems. But as we said, shielding has never actually been done, as the most extreme form. So children have still been exposed, and children were exposed for quite a long time before children. As we know, in this country, we started shielding and lockdown quite late, and even at that stage, there weren't a lot of cases. And certainly, it's also true that children in general get fewer episodes of COVID for reasons that aren't fully understood. Then it's not just that they don't get ill; children with or without sickle cell disease get fewer infections, and it may be that because they get lots of coughs and colds all the time, there's some degree of cross immunity from other infections, but people just don't know at the moment. But it is true that children get fewer infections, and that's maybe partly due to shielding, but not entirely. And I would say probably shielding may have helped, but not. I don't think that's the reason we've seen so few people with problems.
Thank you, David. And let's take the final question, because we've allocated an hour for today's session, but in my announcement we'll be planning for another one because things are changing all the time. So let's take one final question.
Okay, we've got a question about is there any data on the outcome of adults with sickle cell who contract COVID-19?
Well, that's one for Mark. Mark, yeah.
So this is something we've been trying to collect through the haemoglobinopathy centres in England, and we're beginning to get an impression of how COVID-19 affects people with sickle cell at different ages. What is clear is that the pattern is quite similar to that in the general population, in as much as older people, that would include myself and some of the other people here, have a significantly higher risk of severe illness from COVID-19. So we see in the sickle cell population many of the same effects that we see in the general population. Those people who have other medical conditions, particularly heart or lung or kidney conditions, are more vulnerable and more likely to develop severe COVID-19. What I think we don't have a clear answer to is whether there is definitely a higher risk to people with sickle cell disease compared with the general population when you take account of all the factors that we know can influence the severity of COVID-19, including possibly ethnic background. So I think it's still a question we haven't got a complete answer to. What is clear is that many of the same risk factors that operate in the general population apply to people with sickle cell disease. But I think we still have to be cautious in the advice we give in relation to shielding and trying to protect people with sickle and other medical conditions.
Thank you very much, Mark. It's now 5:05. We've just gone over our hour, and the first thing I want to say is just to extend my thanks to David, Kofi, Mark, June and Matthew for enabling a seamless process today, with the exception of Dr. Ivan. So if you can hear us, Dr. Ivan, sorry that we couldn't see you. So the two announcements I want to make, apart from saying a big thank you to all of you who logged in, and there's quite a lot of you who have logged in today. So thank you for your time, and I hope you found it helpful. We will be holding another one, and the reason for that is that the government are gradually lifting restrictions, and we need to understand what those restrictions mean for people who live with sickle cell and their families. So there will be another one probably in about 3 or so weeks time. And also to thank Yamadi for the reminder about the survey. So those of you, Matthew will make sure it's highlighted again so you can complete the survey. But also to share with you, on the 20th of June, there's going to be another webinar. This one is about blood and blood donation, being run by Tracy Williams and Lynn Tessera. So log in to that. More details will be provided on the website about that webinar on the 20th of June about blood and blood donation. So with that, can I thank everybody who's participated. There's some really great questions, you know, and as we know, we don't have all the answers to some of the questions, but some really great questions. And I wish you a pleasant weekend. Keep safe and keep shielding, and washing hands and socially distancing, and do whatever you can. So thank you all very much. Thank you.
Thank you.
Thanks a lot, Jude. Okay. Bye-bye.